Good morning, everyone. We're going to go ahead and get started so that we maximize our time together. And I know some of you are still signing in, so just feel free to come on in. Good morning, Juliet. We're so happy to have you here.
Hi, good morning. I'm so happy to be here. Thanks.
I'm going to take a couple of moments, Juliet, just to introduce you and to share with our participants why we're so excited to have you here. I'd like to just share some of your bio with our attendees. So good morning, everyone. I'm Grace Bagwell Adams. I'm the Assistant Dean for Outreach, Engagement, and Equity in the College of Public Health at UTA, and also an Associate Professor of Health Policy. So I'm especially excited to have Juliet Choi with us this morning, who is the President and Chief Executive Officer of the Asian and Pacific Islander American Health Forum, which is a national health justice organization that influences policy, mobilizes communities, and strengthens programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. Juliet is an accomplished cross-sector leader and coalition builder who specializes in change management, system reform, and stakeholder relations, particularly in the areas of immigration, civil rights, healthcare, and disaster relief. A senior executive, she served in the Obama administration as the former chief of staff and senior advisor of two important federal agencies, the U.S. Citizenship and Immigration Services at the U.S. Department of Homeland Security and the Office for Civil Rights at the U.S. Department of Health and Human Services. Prior to her political appointments, she led disaster relief operations and strategic partnerships at the American Red Cross as a member of the disaster leadership team. She has previously worked at the Partnership for Public Service, the Asian American Justice Center, Mental Health America, and a Fortune 500 corporation. Juliet received her Law School Alumni Association Award for Leadership and Character and Rising Star Alumnus Award. Currently, she serves on the boards of the NAPABA Law Foundation, National YWCA USA, and on the Robert Wood Johnson Foundation Commission on Data Modernization. A certified mediator, Juliet received her JD from the University of Maryland School of Law and clerk for the Honorable Dennis M. Sweeney of the Circuit Court for Howard County, Maryland. She received her BA in Economics from the University of Virginia. So, Juliet, we just thank you so much and extend so much gratitude for you being here today. We really look forward to your presentation. Just to talk about the flow for a second, we're going to hear from Juliet, and then I'm going to facilitate some Q&A at the very end. We're going to leave ample time for discussion, and so we'll go over those logistics when we get there. But for now, just a grateful and humble welcome. Juliet, thank you so much.
Wow, thank you so much, Associate Dean Adams. That was a really, really generous introduction. Hello to everybody who's joining us today, and I'm trying to follow some of the chat comments here. So again, just a large thanks to all of you. My real hope in this morning's conversation is I know you're looking for me to share some information, set a framework for us. I'm hoping to keep my remarks in about the 20-25 minute framework and ensure we've got ample of time for conversation. My preference is really to host together with you a conversation. And so thank you for this forum. Let's see, and then Assistant Dean, do we have a PowerPoint?
We do. Josh is here. Josh Pine is
Yes.
here.
We're sharing it? Okay.
Yeah,
No problem.
let's go ahead and share it. I'm not going to go through every detail of this PowerPoint, but I also wanted to make sure, I know all of you are so busy, and so I thought it would be helpful if I could put some key elements into a PowerPoint that I'm very happy to share and would want to share with you all after today's conversation. Next slide, please. And Grace already highlighted who we are. You know, I also wanted to add, this happens to be my organization's 35th anniversary. So we are the oldest and largest health justice advocacy organization advocating in support and on behalf of the Asian American, Native Hawaiian, Pacific Islander communities. So that you know, we work very closely with a network of community-based organizations across the United States, territories, and Pacific jurisdictions. Our network is 150 community organizations and growing. Next slide. Okay, so before we jump into numbers, because I do, believe it or not, I do love numbers, I do want to celebrate all of you for taking the time of investment for this conversation and for the leadership at the University of Georgia and School of Public Health. This is your 10th anniversary. And Georgia has, I think, a lot of prideful moments, what I want to call prideful moments. And I can appreciate with the changing demographics and community societal conversations, a lot of challenges as well. And again, just want to extend my real sincere thanks to Dean Marcia Davis and Assistant Dean Grace Bagwell Adams as well. I would be remiss after that introduction if I didn't also extend my own shout out to some of my friends and colleagues in the state of Georgia. Being an alum of the federal government, I have so much pride for the Department of Health and Human Services, particularly Region 4, CDC, and having been 2.5 years at the Office for Civil Rights at HHS, I want to say a shout out to our Region 4 HHS Civil Rights. And then some of you know that I have also worked at Homeland Security, U.S. Citizenship Immigration Services, our folks who help to welcome new Americans, refugees, and asylees. So a big shout out to our USCIS folks. And then I was just kind of penciling out like ties and connections, which I think is really important in the work that we do. Advancing Justice Atlanta is a sister organization, and I'm an alum of that civil rights organization and its networks. And being an alum of the American Red Cross, I really want to give a big shout out to the American Red Cross chapter network in the state of Georgia. Okay. And then I thought it would be helpful if I could just share a little personal note about me outside of my formal bio. You did hear Grace share that my alma mater is the University of Virginia. And I can share with you outside of the state of Virginia, Virginia alums are most highly populated in the state of Georgia. And many years ago, I might be dating myself here a little bit. I do remember a time where I had the chance to attend a Peach Bowl tournament with Georgia Tech versus UVA, not the University of Georgia. And that was a fun time. And then with my legal background, I do want to share with you, you may not know, or maybe you do. There's a wonderful community legal leader in the state of Georgia, and his name is Judge Alvin Wong, along with his wife, Jenny Lynn. And the state of Georgia can claim Judge Wong because he was the first Asian American leader to run for public office and in the metro Atlanta area. And then when he became a judge with his investiture, he was the first Asian American judge in the Southeast region. So that's something you all, the state of Georgia has to claim for pride. Okay, so I thought you have access to our health forum survey that we conducted with regard to COVID attitudes, where our communities are. And I thought it would be helpful to take a step back from a national lens and then relate it to where you are in Georgia in terms of your changing demographics, community conversations. And as I jump into this, I do want to say that over the last year year and a half or so, I know in my leadership journey, it has been very, very important to share and declare that I think it is very, very uh, critical, necessary, and welcoming for us as a society to center Black lives as a country. Additionally, concurrently, I also think it's incredibly important for all of us, and I'm still on my learning leadership journey, to center the contributions and the heritage of Native American families and communities to this country. With that, let me share with you what the landscape looks like with regard to the Asian American, Native Hawaiian, Pacific Islander communities. For Census 2020, if you can imagine, I know I needed to read the articles and the research at least a couple of times. So number one, AANHPIs, we are actually the fastest growing demographic in the United States. And since the last census over the last 10 years, the Asian population in and of itself has grown over 35%. The Native Hawaiian Pacific Islander community over the last decade has grown by 30% as well. What that means is today in the United States, we have close to 25 million individuals who identify as Asian American, Native Hawaiian, and Pacific Islander. If we compare that to 1990, so 20 years ago, we were about 6.5, 6.6 million individuals. So again, I think that really underscores the breadth and growth of our population. As it relates to the state of Georgia, you can see here, and there are a couple of additional slides. I'm not going to read this in detail with you, but just from, I tend to be a graphical person as well. On the left side, what you can see is that in the state of Georgia, you can see in certain counties, you have experienced tremendous growth over the last decade. 5, 10, almost 20 percentage points in growth within individual counties. On the right side, what this illustrates is the growth change in percentage for each county in the state of Georgia. And the way I want to describe this is your state is just so much more colorful, and it demonstrates and illustrates that the AANHPI population growth by percentage is actually happening across the entirety of your state. Next slide. And this, I also wanted to highlight this. I think it's very, very important to also highlight Native Hawaiian and Pacific Islander communities. Georgia is experiencing some growth and increase with the NH and PI populations. I think at the national level and other states, you may see larger numbers. You will see larger numbers. But in terms of percentage growth, I would ask you to consider and think about that Georgia is also experiencing percentage growth in terms of population for Native Hawaiians and Pacific Islanders. If you look at the right side here, the color-coded map, you can see, again, the percentage change is tremendous. The darkest purple areas represent 500% or more. Quantitatively, that is still less than 2,000 individuals, but I think it's important to keep in mind the growth in terms of individuals as well as percentage growth. Next slide, please. And before I jump into this slide, given your growing demographics in the state of Georgia, I am so proud to share that our community network continues to grow. I think you may know some of these organizations, other you may not. During our Q&A, I will try to drop in our chat some of the API organizations within the network, within the state of Georgia. And I do want to take a moment to, give a shout out and acknowledge them. The Georgia API Community Coalition, the Center for Pan-Asian Community Services, Vietnamese American Community of Georgia, Asian Americans Advancing Justice, the Asian American Advocacy Fund, the Asian American Resource Center, and growing networks, emerging networks, including a lot of work. One of our national sister organizations, the National Asian Pacific American Women's Health Forum, has been doing a lot of groundbreaking work in the state of Georgia. So with this slide, this happens to be, you can see the title of this article. It's, it always gives me pause every time I revisit this article, which was published in November 2020. When we're talking about health equity, whether it's the AA and HPI communities or communities of color writ large, I always welcome the opportunity for dialogue with the media. And the Washington Post had reached out last fall. We had both anticipated it would be a 15-20-minute conversation, which actually turned into an hour-plus dialogue. And my request to the Washington Post and the media writ large is that when we talk about health disparities and opportunities for health equity, that can we think about talking about all communities holistically? There's a lot of coverage on Black communities, Latino communities, LGBTQ, Indigenous, AA and HPI, rural, senior, youth. But I think for all of us, even though I haven't met with you previously, I think all of us were driven by the same mission, which is we want to make sure our families and our communities and the workforce that supports that work, that we're working together to uplift all of our families and our neighbors. And it's a whole of neighbor effort. So when you have a moment, could I ask you to take a look at this article? It was I thought, a beautifully written article with data, but it includes narratives about the Black, Latino, and AA and HPI communities. Next slide. And so with our mission at the Health Forum, you may know us for many years, you may be getting to know us. I hope it won't surprise you. Since our founding, our core strategic priority areas in advocacy and community engagement and capacity building has always been focused on data disaggregation, increasing access to healthcare, and one proxy for that is language access and public healthcare information available in language. And then number 3, increasing and enhancing community resources. What I'm really, really prideful about this particular report, with the generous support of the Robert Wood Johnson Foundation, which I think many of you also work with, is that they really supported and looked to us, the Health Forum, in coalition with our existing partners to explicitly create a data disaggregation coalition. That may not hit the front page of the New York Times, but for us and our community partners, this was so exciting. And it was a coalition of Access, who is based in Dearborn, Michigan, serving the Middle Eastern Arab American community. Unidos US, the largest civil rights organization for Latinos, National Congress of American Indians, and the National Urban League. And what we did was we attempted to take this national federal dialogue for the importance of disaggregated data and then visit and review state efforts, places like New York, California, and Nevada, highlight in Michigan, and highlight promising practices, wonderful policy, political leaders, as well as the ongoing systemic challenges when it comes to disaggregated data. I know when we talk about data, we can really start to, peel back the layers and get into the weeds on disaggregated data. Informally, if I can say this from a layperson's perspective, I view disaggregated data as a proxy of saying, we will see you, we will see each other. And in order to do that, we really, really do need to, as public health and community leaders, advocate for and champion the criticality of disaggregated data. If you're not seeing, you're not counted. If you're not seen and you're an elected official or a funder or a corporate partner or a philanthropist, we want to, together in partnership, make sure that we allocate resources efficiently, effectively, with intentionality. And we will always be hamstrung, one hand tied behind our backs, if we don't have disaggregated data. The last count, and I know the needle is moving slowly but surely. To date, approximately 27 states now within their public health system does provide disaggregated data for AA-NHPIs. Is it what we want robustly? We're making progress. There's still more to be desired for. But there are certain states where people who look like me and myself, I would not be counted. I would show up as other. And I'd like to think, just like you and our families and our neighbors, we all deserve to be counted. Next slide. Okay. So within the conference preparations and the agenda, you already have a link to the survey. So I'm just going to share a couple of highlights. For us, like many of you, developing strategic partnerships is absolutely critical, and building off of the need for disaggregated data. What I was really looking for together with our community partners was some level of a national survey to at least ground, hallmark, bookmark the status, the attitudes of COVID vaccination, and then throw in a few additional questions just to see how is our community faring. What I am so proud about this particular survey, and it's the only, if not one of less than 3 national surveys that does survey Asian American, Native Hawaiian, Pacific Islanders with a respondent pool of over 1,500. It was not easy. We had a lot of lessons learned. I think in the future, if and when we engage in this again, there are a lot of learned lessons we have in terms of, delivering a survey instrument to a largely immigrant population. That said, this was just really a hallmark survey for our community that, thanks to you and UGA, we are sharing with you as well and ask you to amplify. Next slide, please. So I'm not going to walk through all of these details, but again, want to make sure this PowerPoint is available to you because we've included some hyperlinks for your efforts. A few highlights and also captured in the pre-materials is the fact that even within the AA-NHPI communities, and my organization with the with the terrific partnership and support of the federal CDC, we have developed a national response partnership for COVID. And in our work, but through this survey, what we have been able to ground is that vaccination rates, and again, the survey was completed over the summer, vaccination rates for Asian Americans were pacing pretty well at 80% percentage points or above. However, and not surprisingly, the vaccination rates are lagging behind Asian Americans and behind the national rates for Native Hawaiians, who are vaccinated at a rate of about 60 to 63 percentage points, and then a little bit lower for Pacific Islanders at 55 percentage points. I think, in this pandemic, global historical pandemic, I'd be remiss if I didn't underscore that over 1/3 or 37% of respondents did share that they know someone personally who has died from COVID. And if I may, at this point in time, for all of our public health workers and leaders on this call, um, I just think you continue to be our unsung heroes because you are getting the information, the changing information out to our communities and families. And as you're trying to navigate the changing federal guidance, that you face critiques, if not unfair critiques and attacks. And you are, if you're not already burnt out, you've experienced phases of burnout and incredible stress and mental health stressors. So I do just have to thank all of you as public health leaders and community leaders. You have my gratitude for the work that you do day in and day out. I think another element to highlight within the survey, it was very important for us to capture a pulse check of how anti-Asian violence is continuing to impact all of us within our communities. And with this survey, 70% of our respondents stated that they truly do believe discrimination against the AANHPI community has become more common now post-COVID, which is very, very tragic. If not, I will share as an advocate, infuriating. And at least 50% of our respondents also reported that they personally or a family member has experienced an incident of hate or attack since the pandemic began. I will share with you personally because for conversation's sakes, I think it's helpful to ground this in reality. I've lived in the DC, Virginia, Maryland area for over 30 years and really have never experienced a hateful incident in public until and since January of this year. And just since January of this year, and I actually happen to live about 8 minutes from the Smithsonian Museums and about a 15-minute walk to the US Capitol. And since January, I myself have experienced a handful of public incidences of, being called things that I never thought I would actually hear personally, and being intimidated. I think another element from the survey that's really, really critical to highlight, which I think you already know, is that there is a growing need and gap for mental health services, I think, for all of our communities. I will highlight the AA and HPI communities. And our survey, what we heard is that over 1/3 of our respondents have stated that mental health is a critical area of concern and an unmet need. And this happened to be particularly more expressed by a younger demographic, 18 to 35. Uh, and I want to underscore a nuanced element to this. There's a cultural element, there's always the language barrier, but the cultural element, not unique to our communities, but a key consideration is that there is a real big cultural stigma for stepping out proactively to say, I need help. Um, I need help and assistance and mental health services. I don't have the solution to this, but in your community and statewide conversations, given the changing demographics in Georgia, and you have led in a lot of areas and you face challenges in other areas, I do want to say a little bit more optimistically that given your commitment, your passion, and your investments, I'm hopeful that perhaps Georgia may be one of the innovative states in terms of service delivery, both from a healthcare standpoint and a mental health care delivery standpoint. Next slide, please. And we may slip, yeah, I talked through this, so let's go ahead. Next slide. Briefly, I want to mention one statement here. I think where we all are nationally, statewide, and locally, I'm looking at the right side of this slide, children's vaccination status. I know, like you, that towards the end of October, we are anticipating additional federal guidance on vaccination guidance for children, particularly age 5 through 12. And so I take a look at the survey and see that within our communities, many children had been vaccinated. But I always keep my eye on those who have not been vaccinated and are ensured that they will be vaccinated. Again, this survey was from the summer. When I put those two categories together, it's about 24%. I'm going to round that up to 25, which is a quarter of our respondents are saying they're not sure if their children will get the COVID vaccination. On top of that, we also know that there is guidance on getting COVID booster shots. So when we think about our families and especially our young people, this is a particular area of concern, I think, for all of us to pay attention to. And then here too, I will highlight the intersectionality of anti-Asian violence and the incidences. Through our community network, I cannot underscore how many stories we have heard that even earlier this year, when individuals had those very, very precious appointments for a COVID vaccination, they quote unquote opted, felt like they needed to shutter in and stay at home because they were too fearful to literally step outside of their home, or they were too fearful for another family member or a senior member, an elder, to step out of their home to receive a COVID vaccination. For the younger children, the stories and the narratives we have heard is that the incidences of bullying, child to child, youth to youth, or even cyberbullying continues to increase. So again, going forward, when we think about sharing public health guidance and making sure our families are vaccinated, I do ask us to consider the intersectionality of public health priorities, what this means in the context of a growing environment of anti-Asian violence, and the changing demographics of bigger, larger immigrant populations where language really is a barrier. Next slide, please. Next slide. I'm going to skip over this. Here, I think the top line message, nothing surprising, but I want to tie this to a future point and something in our conversation I hope we'll have is that we know that you, as community and public health leaders, are doing all you can to reach out to communities. And it is, there's no magic formula here to really have it. What we're hearing, not just through this survey, but other surveys, is that we need to collectively continue to build our network of partners, trusted partners, strategic partners. And I invite us to think about like really innovative partners. I'll put my organization, front and center as an example. Traditionally, we have not worked with faith-based organizations. And earlier this year, for me, it was very important to reach out to an organization called the Tzuchi Buddhist Foundation, and they have a medical foundation. And they're known for being really credible leaders from a philanthropic perspective, from a faith-based perspective, but also from an interfaith perspective. Another new strategic partnership for us, especially thinking about the intersectionality of COVID and hate crimes and hate incidences, is the National Asian Pacific American Bar Association, which is the national organization of APA lawyers and judges. And in partnership with them to counter the anti-Asian violence, I thought it was really, really critical, sort of in rapid response fashion, to create a toolkit just to talk about and define what is a hate incident, what is a hate crime, why it's important to report this, and try to create some helpful background and talking points to equip community organizational leaders to have this conversation, at the local neighborhood level. It was important to try to create something like that. I thought maybe something like that existed nationally. It did not. So in May, we pushed that out. And for me, it's important to walk the walk. I advocate on overcoming the language barrier. And I made a clarion declaration with my staff and our partners that we would create this toolkit in 24 Asian, Native, Hawaiian, Pacific Islander languages. It did require some investment on my organization's part. And what I was really, really gratified to hear from our community was, number one, thank you, this is what we need, especially in language. We didn't get it perfectly right. And for me, that's okay. You have to start somewhere. And, we got some feedback that the translation was pretty good, but not 100% on mark. And making sure the materials are relatable in a cultural perspective. We're still trying, but I think it's important to do something versus nothing. And then lastly, the feedback we received is that instead of 24 languages, we needed to add a few more additional languages, which is a really wonderful feedback loop. It keeps me and my organization on our toes. But again, just wanted to express this as a demonstration of walking the walk, and really highlighting that when we make some investments where maybe we haven't before, it can make such a huge impact that as of today, we cannot fully measure and appreciate. Next slide, please. And I'm also going to do a time check. Next slide, we can move on. Okay, so here I do want to highlight, we all know, and the country knows that with the wave of anti-Asian violence, Georgia, there was the tragic, very, very tragic and brutal incident of the killing of 8 individuals earlier this year. 6 of the victims who were Asian American women, all immigrant women. So I would be remiss in today's conversation if I didn't highlight this. again, if I were there, and I am right there virtually with you, um, this really does highlight and underscores how hate rears its ugly head. Uh, and this particular incident was historically tragic. I also want to fold in some historical context here. The wave of anti-Asian violence, what we are talking about and experiencing, is what I call the modern chapter of anti-Asian violence of 2020 and 21. With your help and advocacy and championing, I'm hoping that 2022 will be a different year. I'm going to take a step back and highlight that from a historical lens, starting with our US immigration laws, this wave of anti-Asian violence actually happens every 20, 30, maybe 40 years, and first started in 1875. Let me say that one more time. 1875, with the Page Act, which was the first anti-Asian immigration law on the books, targeting Chinese women that were applied broadly to all Asian female immigrants to the United States. The Page Act was a precursor to the 1882 Chinese Exclusion Act, which again, when our country was welcoming immigrants, instead of welcoming Asian immigrants through the Statue of Liberty, Asian immigrants, for the most part, were being rerouted. This goes up to the early 1900s to a place called Angel Island off of the San Francisco coastline. So if you've not heard of Angel Island, I invite you to Google and just do 5-10 minutes reading of the history of Angel Island, where Asian immigrants were detained not days, but weeks, months, if not years, and treated very, very differently. I could walk through sort of a civil rights history of the many years and the different types of laws that structurally created and continue this notion of anti-Asian violence and hate. But I wanted to make sure that I grounded that we have laws that go back hundreds of years. And then if we fast forward, you know, this creation of the model minority myth was actually a fictional political narrative creation that our communities continue to counter. Fast forward once more in the 1980s, there was the death of Vincent Chen when, you know, automobile workers in the state of Michigan facing economic challenges, I think, which is a dynamic we are experiencing in our society now. There was a terrible murder of Vincent Chen. So that's another civil rights and anti-Asian hate violence chapter that I would ask you to take a look at and read about. The reason why this is important and for our conversation going forward is that we're also talking about, with COVID and healthcare, how do we build trust? And so for those of us in our community and our friends and our allies and supporters, when you think about just a single incident of hate, it just punches you in the gut and pierces you in the heart, and you immediately affiliate these past incidences in our American history. There's a lot of good in terms of welcoming our communities, but when we are talking about hate and then fear and crisis management, I think it's important for us to realize and appreciate that these experiences and these historical chapters are all interconnected and tied. Next page, next slide, please. And like you are engaging in conversations, hosting national, state, local, regional fora. You are talking with the media, you are writing articles, you are doing research, you're creating initiatives, you're creating new partnerships. I'm a big fan of memorializing what's happening in that moment of time. When I was at the American Red Cross and my work there for almost 5.5 years included running national disaster relief operations. And I always balance the national lens and that individual and community experience. For that individual community experience, especially in a time of crisis management, if your health is at stake, if your home is at stake, if your sense of safety and well-being is at stake, that's a traumatic experience that you will carry with for the rest of your life, and it begins to influence and shape your worldview. And as a national leader and as an advocate, all of us are advocates. It's so important to find different ways to memorialize what's being experienced in that moment in time so that in the short term, we have something to reflect upon, share, and learn from, and dialogue together with. And then in a few years' time, and then in 5 and 10 and 20 years forward, I want to make sure we have something to wrap our arms around, and we have some writings and records to reflect what we've all experienced. That's a big wind up to this particular article. I do want to extend real sincere credit to Dr. Howard Koh, who is now at the Harvard Chan School of Public Health. He's a dear colleague of mine from the Obama administration, where he served as the former Assistant Secretary of Health and one of the critical leaders for the White House initiative for Asian American Pacific Islanders. And then Jeff Caballero was the executive director of what I consider my sister organization, the Association of Asian Pacific Community Health Organizations, APCHO. We're all into acronyms. And APCHO is the national organization membership network for the AA and HPI community health centers in the United States. But this is a relatively short read. I think in tiny font, it's less than 5 pages, but it really does touch upon a lot of the things we've talked about. It was published, I think it was August, September, and our data and research, we captured our numbers as of this summer. Next slide. Okay, so I'm doing a time check. I'm at 10:33, and so I think we do have plenty of time for a dialogue. And thanks to Dean Grace, she'll help to facilitate your questions and comments. And as we're doing that, just to give you some time to get your feedback to the Dean, I just think this is a tremendous opportunity of how do we think about innovation and creative partnerships to tackle and mitigate against the challenges that you and I, that we're all facing. And that's why I put, instead of just build or rebuild, I did the rebuild/trust and engagements for impact in a real meaningful way. Again, all of you really are my heroes. When we think about the intersectionality of public health, providing care, but also anti-Asian violence, a couple of other figures that I want to share with you is that about 20-21% of the US population of physicians and surgeons is AA and HPI. And just like all of you have faced really tough days of being attacked for just really doing the best you are doing for your job. These doctors have faced trying to save lives while being attacked. Our nurses, all nurses, my hat goes off to you, particularly for our Filipina nurses. Filipino nurses represent about 4 to 5% of the professional nursing field, and to date have experienced about 30% of all nursing fatalities from COVID, meaning they have served, they were infected with COVID, and then sadly passed away. And so for me, it's very important to, acknowledge some of the tragedies that we're all experiencing. And then in the same breath, champion who you are and what you do every day. And like grace is extending to me, I'm inviting us, and we'll ask you to carry it forward. Leadership matters, words matter, visibility matters. The fact that UGA and in your conference, you've invited me to speak, not just because of my experience and the role that I have, but the fact that I look like this, I think matters. So I want to thank you and celebrate. I shared with my staff and my board. I'm so excited to be meeting with UGA and its community network. If you have junior staff or senior staff, we can all do something today or tomorrow. You can pull that person next to you. So in your next leadership meeting or management or team meeting, you change the narrative, you change the visuals, and people get to see more people that look like me. And if you need more staff, like help us, let us know. We'll help you recruit. But I have no doubt within your networks, you've got wonderful staff, colleagues, leaders, alums, community partners. And so I think those are easy, but very, very important things to do. So with that, Grace, I'm going to turn it over to you, and really looking forward to our conversation.
That is wonderful. Thank you so much, Juliet. I really enjoyed the storytelling that you've done for us. And I think that you've laid some really beautiful groundwork for us to have a good conversation. So I'm just going to invite folks to turn their cameras on. Even though we don't have the luxury of being in person, we do have the ability to see each other. And I want to be able to have that our conversation by greeting each other face to face. And we do have about 30 minutes. You can go to gallery view. Josh has written in the chat. So if you access the chat, that's how we're going to be going into the Q&A session now. If you click on the upper right hand thumbnail on your screen that says view, you can choose the gallery view so you can see everyone. And I am just going to invite you to use the chat to put in your questions, and then I will facilitate a discussion with Juliet so that she can answer those questions as we go. But again, we've got about 30 minutes for questions and answer, and feel free to ask questions about any aspect of her talk, or if you have broader questions than that, I'm sure that she can handle them beautifully. So just go ahead and use that chat window for some questions. Juliet, while people kind of get their thoughts together, I'll kick off. Selfishly, as the moderator, I guess I get to ask the first one. So, in academia, one of the things that I've noticed in the last 2 years is my students in the classroom are really hungry to have meaningful, difficult, deep conversations about race, about ethnicity, about a lot of the issues that you have talked about today. And so one of the things that I've noticed, one of the questions that they have is, what can we do? What can we do as students of public health as we go into the field and begin careers in public health? And so I guess as someone that has been working in this field and has been working specifically on these issues with a leadership role, what advice do you have for students of public health, as they go into the public health workforce, who are really passionate about these issues, who want to hit some of these issues head on and start really, being leaders in their communities, as you have suggested that we all really have to do. What is some of your advice for our students?
Sure. No, that's a great question. And I think moderator privilege is always really, really great. Particularly for students, I'll approach this very informally, right? So that folks can start tomorrow. If folks are not already part of the American Public Health Association, I invite students to, sign up with the association. Um, APHA, I truly do believe, and full disclosure, I signed up as a member as well. Um, they have really done a robust effort of curating a lot of articles, doing a lot of thought leadership, lots of different conversations and different fora. So I think that's like a really easy one-stop shop to get plugged in. And then it allows you to get plugged in not just locally and statewide, but nationally, and also different across different affinity groups. Number two, I think the public health community has led this for decades. And I'm hoping there'll be like a renaissance movement around this, which is even as students, I think there's a real wonderful opportunity, and while you're still in school, to take advantage of this, is to create either seminars or convenings that are interdisciplinary. As I share, Virginia was my undergrad alma mater. I went to Maryland Law. One of my favorite courses during law school was a bioethics philosophy course that I took, and it was interdisciplinary. That included our medical students, our nursing students, social workers, and pharmacists. So if you don't already have an interdisciplinary forum, I would ask and invite you to consider that. This may expose my own bias. I do think it's helpful to, not all lawyers are created alike, right? But I do think that engaging and pulling in public interest law students and lawyers into your networks is helpful, because when we're thinking about social determinants of health and public health and addressing racism, there's a lot of intersectionality with the law, with the civil rights laws that are already on the books. And I know for me personally and professionally, I'm eager to see more of those intersectional dialogues happen.
Thank you, Juliet. I think that's so helpful. And a lot of really practical advice, not just for our students, but for all of us in public health. From Sophia Perez, we have a question. It is, have you tracked vaccine hesitancy and acceptability in AA and HPI communities as it relates to pregnancy? And if so, what is your organization's approach to this situation?
Yeah, Sophia, thanks for that question. The short answer is, breaking that demographic down to women and pregnancy, no, we have not. The survey that we highlighted today, I will share, we're enormously proud that we were able to conduct that survey. And when we're talking about system change and advocacy, I will share, quote unquote, quietly in this community conversation, to get that survey put together and done was, it certain days it felt like, it was a real challenge. We were all like philosophically invested, and talked about, do we do 500 respondents or 600 respondents, and I pushed really hard that I wanted it to be 1,500 or more. And part of the learned lessons, if you will, is, we've all been invited to take a survey at some point in time in our personal professional career. how someone reaches out to you, what they sound like, what they look like, what medium, is it paper or online, all influences whether you're going to participate or not. And I want to be open and transparent here. A lot of part of the feedback that I got was, and questions that I received were, Juliet, are you going to translate this survey into languages? And will you do the interviews orally in language? And initially, I was trying to be as aspirational as possible. And then we landed on, we're going to do this particular survey English only. So I really do appreciate your question, because I think it speaks to not just for our communities, but all communities. I think this is a really, really important demographic. For women, I think the other sort of like factoid or statistic I want to highlight, when you think about anti-Asian violence, Stop AAPI Hate, which is another national organization that's been was created because of the anti-Asian violence during COVID. They consistently report, and this is in alignment with previous surveys and other surveys that are done. Those reporting an incident of hate from the AA-NHPI community, 2/3 of the reporters are women. So there's a gender disparity here. When I say this and I see some heads nodding, it's not surprising, but it's important for me to say that out loud as well. And so in all areas of our public health, our community care and outreach, I think thinking about gender disparity is also a very, very critical dimension and demographic. Thanks, Sophia.
Absolutely. Absolutely. I think we've seen so many examples of, with the pandemic in particular, just pulling back the curtain on a lot of the disparities that were there, but just really exacerbating them. And one of those areas is definitely maternal and child health, for sure. Okay, from Vinnie LaFranza, we have, in public health, we are extremely concerned about increasing violence. At the National Network of Public Health Institutes, we are supporting our public health partners in the government and private sector in training and other initiatives. We are hiring a new director of health and racial equity right now. So here's the question. What do you suggest we do to best support our AA and PHI public health workers on the front lines?
Yeah, that's a great question. And I'm jotting down notes. So when I'm looking away, I'm not ignoring you. Just want to make sure I jot down my own notes. And it turns out next week, I'll actually be speaking at the Milken Institute. I'm only going to have a few minutes, but like I want to carry with me the questions and comments that you're sharing with me today. To how to support NHPI public workers. This is it's our public healthcare workers, and it's also, and I've been invited to speak with, industry and corporations as well, which has been, fascinating and interesting. I want to go back and say leadership matters, words matter, visibility. And if you don't have API leadership, in your top ranks, the leader and the top leadership team, in unison underscoring the expectations and the support and the facts, saying things like, we see our AA and HPI colleagues, and we know we need to create space, and that can be like in a forum, but probably more importantly, it's creating space for a dialogue just one-on-one. Honestly, I've actually been surprised as well. I've been invited to speak with different organizations, private, nonprofit, but also local and state governmental agencies. And every time I say that in a safe space, someone will either say in front of their colleagues, for the first time, my family and I have been experiencing this hate over the last few months, but I just didn't feel comfortable bringing that to work and saying that because I wasn't sure how my colleagues or how my supervisor would respond back to me. Would they would they be supportive? Would they be stunned and frozen? Um, would they be less than supportive, um, and somehow feed into additional anxiety? So again, we all go to work every day. If we can think about ourselves or our sister or our brothers or our children or our parents encountering that, I think creating space in some way is really, really important. I'll also highlight, it needs to be something more than just a one and done conversation, right? And then here and there, one of my colleagues is, I don't think he's going to mind me saying this because he's a public official. He's a port commissioner in the city of Seattle, and he did a tour of the airports and just did a walk around. Folks knew who he was, and he was just very, very surprised at how many airline workers who are APIs just like walked up to him, not knowing who he was. I mean, knew him in title, but just said, like, I heard you're talking to folks and you look like me, so I just feel like I can talk to you anonymously. And so from there, it created a dialogue with the airports and the port authority of creating a hotline for employees to report incidences, at least so that folks could track. And then just revisiting, I would always say, and I used to say this, especially when I was at the Red Cross, in your workplace today and tomorrow, you can revisit what is your employee assistance program? What services do you have? I know with my own staff, most of my staff, believe it or not, are based in Oakland. I have said, if you don't know how your insurance benefits work, your mental health services and benefits, if you don't know how our EAP works, because you can get free counseling anonymously, like call the 800 number. It's all anonymous. Like these are resources for you. And as a management team, I've also asked my team, like, we don't want, de-identified information, but from a statistical perspective, is service utilization going up? I think that's a good thing. If it's staying steady, then from a manager leadership perspective, do I need to like promote and talk about that more openly? Again, when I was at the Red Cross, those are some things that I would talk about. I think now we have to figure out how do you do that virtual walk around and let your staff know, hey, how are you doing? I myself am feeling tired and stressed. And so I'm planning to take some time off, but I also think I need to go get some supports. And I just want to let you know that sometimes I can have a hard day too. And we need to extend grace to one another. So it's, again, I see a lot of heads nodding. We all know this instinctively. It just requires, I think, a little bit more intentionality. And, it's I think a little bit harder on some days and a little bit easier because we know how, even in this virtual environment, there's hate and there's COVID, and then just this virtual environment. It's we're in a stressful environment, period. So I'm hopeful that if I say things like that publicly, it will encourage others. I will not put individuals on the spot, but when I do get invited to leadership circles and a roundtable, I do ask, this is more of a rhetorical question. What are you doing? Do you think you can step it up a little bit more? And if I can relate this to like immigrant populations writ large, we have a growing African immigrant population. We have a growing Latino immigrant population. The disability community, I think, faces similar and different challenges. The LGBTQ communities face similar and different challenges, as do our younger generation and our senior generation.
Thank you so much. We've got a question here, some thoughts and a question from Adam Chin, who is on faculty in the College of Public Health. So first, some gratitude, Juliet. He said, thanks so much for the wonderful presentation. As a naturalized Asian American, it really resonates with him. They've done a study with colleague Dr. Stacy Zhang, the Health and Ethnicity and Pandemic Study with the acronym HEAP. And they found that the Asian American has less means of coping with the pandemic, such as the use of telemedicine. So we'll pause there for a second. Do you want to respond to that finding or to that thought that Asian Americans, according to the study that he's done with Dr. Zhang, have had less means of coping with the pandemic, and particularly things like access of the use of telemedicine?
Yeah, Adam, uh, it's and thank you for sharing that you're a naturalized citizen. Part of my role at USCIS was hosting and conducting naturalization ceremonies. So that is something that, one of my highlights of my professional career. And thank you for being who you are. I'm going to trust you on your research. I don't know the portfolio of research in terms of how AA and HPIs are faring in COVID. What is reverberating is, again, the growing mental health issues and needs, and the lack of an infrastructure to mitigate against that. Anecdotally, just from my experience, and I call myself one of those recovering lawyers in Washington, D.C., who's still trying to figure out what she wants to be when she grows up. When we talk about mental health, especially for our communities, you know, it's a tough but illustrative challenge to look at and ask the question, what kind of infrastructure and framework do we have? Um, because if it's COVID, maybe I will put it more generically in the context of just crisis management of life, period, which I saw a lot of, especially when I was at the Red Cross, right, with disasters. Um, but from a mental health perspective, oftentimes, and maybe you can appreciate this professionally and personally, there are certain terms and services and approaches of healing in English and the American way that simply do not translate into our own cultures. Like I'm Korean American. I used to ask my friends, like, how do you translate social worker into Korean? Like I can do a literal translation, but it doesn't get us to where we want to get to. It's improved over the last 10, 20 years, I'm happy to say. But then you've got the workforce issue. So if you have cultural barriers, um, and I also, we call it cultural barriers, but it's also in the work that you do, it's meeting our families where they're at. Um, how do we get an overview and a learning of meeting somebody culturally where they're at? I'm not a New Yorker. Um, maybe I'm wrong, maybe I'm right. I feel like having spent most of my, teenage, college, and adult years in Virginia, I think for me, just culturally, community wise, I think if I needed to or wanted to or had to move to Georgia, I think I would feel comfortable adjusting. With my New Yorker friends, I don't know how comfortable they'd feel adjusting and moving down to a southern state, right? And hopefully that brings a chuckle and a smile to your face. But I'm also getting like, how do we meet folks culturally where they're at, let alone, okay, if we encourage our colleagues to seek healthcare or mental health care, um, wouldn't you want to talk to your care provider in your own language? Um, and I think the other very loose analogy that I use to like go above like race and ethnicity is, you know, when you're having a really bad day or you're really feeling under the weather, what do we all say? We always we seek our comfort food. Um, and I think that's a different kind of translation interpretation of who we are, where we come from, and what we need. I mean, I was born here. My folks immigrated to the US in the 60s. I was born in Pittsburgh. I'm an American gal. I love my hamburgers and hot dogs and pizzas, and give me a bag of potato chips. I'll eat the whole thing. But when I'm really under the weather and I really, really want something because I'm having a tough day, I actually strive for like really spicy hot kimchi and some Korean food. So that's more of a narrative, a dialogue with you, Adam. The research that you're doing, I applaud you. If you want to send that to me afterwards, you know, any one of you in all of your work, if you're not already, if you haven't visited my website, you know, apihf.org, can I invite you to? And I'd love to invite you to sign up for our listserv and follow us on social media. Particularly on social media, we love to amplify the work and outreach efforts all of our partners are doing. So Adam, would love to get that research from you and find a way, number one, to read and share with some of my colleagues, and then amplify.
Thank you, Juliet. There's one more follow-up from Adam that I think dovetails really nicely with the conversation that you were just having, and that is, you know, there's a lot of heterogeneity in subgroups within the Asian American AA and HPI population. And so Adam asks, and now I'm curious too, could you share about building alliances and reaching out to different groups, potentially with, you know, many different language and cultural barriers? Just what are some best practices that you and your organization might suggest in building that community collaboration and partnership?
Sure. This building networks and, you know, alliances and coalitions. This is I love doing this, and I will also share. It is not easy. Particularly, I will share if you've done community outreach, and if there are any misunderstandings or misgivings or bad feelings or hurt feelings. I always say building new relationships is, you know, you need to ask like 5 of your friends and ask them to, you know, share their networks with you. If there's been a misstep or a misunderstanding or hurt feelings, that requires like a lot of special care, love, and attention. Um, I think for our communities, I mean, so diverse. The state of Georgia, you know, I did some quick highlights. Um, in terms of diversity and population growth for AA and HPIs, the state of Georgia is definitely top 5 states in the country. You know, in some of your counties, the percentage point of growth is just like, you know, and just astounding. But I do think it's great to start with folks that you know. Just start somewhere, and find ways to get the word out. Uh, and I also think this is an opportunity, not just across communities, but industry. I have stayed in close touch with my folks that are affiliated with Asian business chambers, for example, because any immigrant population, but particularly APIs, we always have a booming, growing population of small business owners. And so if you have not invited or gotten to know your local chamber of commerce, your API chamber of commerce, I have no doubt they would welcome hearing from you, either for like a community meeting or even just a joint celebration or even information dissemination. Because it's important to think about different organizations that can help you create additional connections. Also, in the state of Georgia, your legal network, so the Asian Pacific American Bar Association of the state of Georgia, is very, very robust. And a lot of these lawyers and judges, they already sit on other local boards of nonprofits. So they are going to be a resource rich set of networks for you. Yeah, there's no magic formula. It's just intentionality, trying different ways of outreach. And if it doesn't go so well, you're not in it alone. And my approach is just to be transparent and let folks, we did this joint community town hall or a celebration or healthcare enrollment, or let's do a pro bono file your taxes, or pro bono let's sign you up for citizenship application clinics, and bring in business chamber and legal groups and public health organizations. Usually it goes pretty well, and sometimes there might be a couple glitches, but no one's going to fault you for trying.
It's great advice. I think we have just a couple minutes, and so Juliet, I want to give you the opportunity if you have any concluding thoughts as we finish up the session that you'd like to share.
Yeah, I mean, really, I just have to say thank you so much for who you are and what you do. And I'm always very, very humbled when folks actually want to hear what I have to say, because you're already leading this, living this, and doing it. Um, and I don't know. Sometimes I feel like I get to like jump in from a national level and just I really wish I could jump on a plane and be here with you in Georgia. I do know our conversation was very intentionally centered with the Asian American, Native Hawaiian, Pacific Islander communities. I think a couple of closing comments would be, even in my own learning and my current leadership journey, is that with the disparities, the Native Hawaiian community and the Pacific Islander community is smaller in numbers to the broader diversity of the Asian American population. So in your work in the state of Georgia, I project and predict that your demographics are going to continue to grow and change. I think, because in part with this conversation, think about how you would include outreach and engagement with the Native Hawaiian and Pacific Islander communities. And then even more broadly, I think the framework of today's dialogue, my training as a civil rights lawyer, I do believe the framework we've discussed is mostly applicable to so many of our communities, right? Whether it's rural America, African, Latino, Indigenous, disability, LGBTQ, and I think you've noticed intentionally throughout my conversation, I wanted to name all of our communities, and gender. So again, just thank you for what you do. You are our heroes. You inspire me. I look forward to staying in touch. Feel free to hit me up on LinkedIn. I don't know if you use LinkedIn, but just let me know that we connected through UGA, and then that'll help me jog my memory, and would love to stay connected. And Dean Grace, you are so graceful and generous. So thank you. Thank you so much.
Thank you. This has been an honor and a pleasure. We're so grateful for your time and your wisdom. And I'm going to now invite everyone to have a 5-minute break and then to join the general plenary. And again, Juliet, thank you so much